A mood disorder is a persistent disruption in emotional equilibrium that interferes with your life. So we all have ups and downs, but when we talk about mood disorders, we're talking about something that persists over weeks and causes interference with your day-to-day activities. And generally speaking, when we talk about mood disorders, we're talking about depression, but there are different kinds of depression. So it gets lumped under the heading of a mood disorder. Mood disorders are important to keep track of in MS for a couple of reasons. One of the reasons is that they're under-recognized, under-diagnosed, and undertreated. In the general population, the frequency of depression is about, say, 10%. In the MS population, it's about 6 times that. So about 60% of people, give or take, over the course of MS will have a major depressive disorder. So it's a pretty common problem in MS. And the other reason it's really important to keep track of is that the single biggest predictor of a reduced quality of life for people living with MS is not physical symptoms, it's depression. So depression has a big impact on how people live with and manage this disease. When we think about depression in MS, I usually think about it as coming from about 4 different places. One place that it comes from is from the disease process itself. So we think that the actual disease of MS in the brain is a cause of depression. So depression can be a symptom of MS, just like spasticity or numbness or tingling. Depression can be reactive to the process of having a disease, living with a disease and all the difficulties of living with and managing a chronic illness. So it can be a reaction to the diagnosis. It can be a reaction to changes in the disease course. So it's common for someone to be depressed when they get diagnosed. That kind of depression might look a little bit different than the depression you might have 6 years into the disease when you're just worn out from living with it. Another cause of depression in MS is medication. So some of the, particularly the disease-modifying therapies, the interferons, have been correlated with depression. And there are other symptomatic medications that can contribute to depression. Depression isn't correlated with disease severity. So it isn't necessarily true that if you have bad symptoms, you will be depressed. In fact, my experience is a bit to the contrary, that sometimes people will develop a pretty significant depression when they're doing quite well physically. And I think sometimes that's because now they have the time. They're doing physically better. They have the time to focus on how they feel about this. I think it's important to stress that depression isn't a sign that you're not managing your disease well. Depression is something that comes along with, mood disorders are something that come along with having a chronic illness, and not a sign that you're not doing it right. I think it's also important to stress that people don't always know they're depressed. So we have a notion of depression as someone lying around on a couch weeping, filled with suicidal thoughts, and sometimes that's the way depression looks. But a lot of times it doesn't look that way, and when people have a chronic illness and they've been struggling with the stress and strain of living with a chronic illness over time, my experience is that they don't even know sometimes that they are depressed. I think it's kind of getting worn out from living with the disease, and so what I find are symptoms of depression when people are into the disease process 2 or 3 or 4 years is that the most predominant symptoms they can have would be a sleep disturbance and a lot of irritability and just a subjective sense of being terribly worn out and unable to manage one more thing. So depression has many faces, and it's important to talk to your healthcare provider about it because, as I said before, it will interfere with the quality of your life. It will interfere with your ability to cope, and good coping skills are essential if you're going to manage this over the long haul. And the third reason is that depression is actually quite treatable. It's one of the things with MS that we have some pretty good success at managing. So there are really good medications and other interventions like therapy and group therapy that can really be helpful. For more information about this topic, please check out our website.